Welcome to Stop Overthinking, the podcast for overthinkers, people pleasers, and perfectionists who want to feel calm and confident enough to handle whatever life sends your way. I'm your host, Kristen Odegaard, a women's life and mindset coach, lifelong educator, and recovering perfectionist. Back to the Stop Overthinking podcast. I am excited to have Dr. Mary Alice Mina here with us today. We are going to be talking about skincare and skin minimalism. Dr. Mary Alice Mina is a Harvard-trained, double-board certified dermatologist and dermatologic surgeon and leading expert on skin health and skin care. She is the host of The Skin Real, a podcast for people looking for real skincare guidance by true skincare experts, where she emphasizes a holistic and preventative approach to skin health and aesthetics. With over 15 years of clinical experience, she is an invited speaker on podcasts at national meetings and is recognized for her artistic eye and surgical skills while helping people feel good in their own skin. She is the co-owner of Baucom and Mina Derm Surgery in Atlanta, Georgia, where she treats patients with advanced surgical and cosmetic procedures to restore and maintain healthy skin. So we are so happy to have you here today, Dr. Mina. Welcome to the Stop Overthinking podcast.
Thank you so much. I love this podcast. And yeah, we all need to stop overthinking, don't we?
Yes. So, as we were just talking about, the focus with the guests that I've been bringing on recently is to bring people forward that can help with topics that women stress about, overthink about, or that are just a part of their lives. And we know that as women, skincare is a huge industry. It's something that we're looking in the mirror, we're faced with literally every single day. And there are so many products out there, so many voices out there. And so it's nice just to have an expert to be able to break it down. When we talked ahead of time, you had suggested actually the topic of skin minimalism and why less is more. And we are going to talk about that today. But why is that of interest to you, or how does that come about?
Well, thanks for that introduction. It came about because just like your listeners, I too get overwhelmed with all the information out there and all the products and all the reps come by and bring different stuff, and it's like, oh my gosh, like there's so much. What do I really need? And I see this also now, now I'm a dermatologist. I've been doing this for decades, but I see it in my friends, my family, and I'm at an age, at least kind of midlife, where people are starting to notice changes in their body, changes in their skin. Maybe for your 20s and most of your 30s, you could kind of fake it. You could get by without necessarily doing all the right things. But I feel like it starts to catch up with you. And if you're in your late 30s, your 40s, your 50s, you're starting to notice things are changing. Aging is happening. Life and stress and maybe all those choices we've made in the past are catching up to us. And so I find this is a period where people are really interested in, oh, wait a minute, like, what do I want to turn things around? I want to make sure that I am not aging prematurely, that I am feeling the best I can. And so I find that this is a pivotal moment in people's lives where a lot of people want more information. They're just feeling really overwhelmed because they don't know what to do, who to listen to. And we're bombarded with, buy this, use this magic cream. This is going to cure everything. Do this procedure. And it's overwhelming. And that's really why I started the podcast, is just to give people real information without the gimmicks, without the hype, without trying to sell you something. I just want to give people good information. And this is a long-winded answer to your question, but what I realized, I thought kind of everyone just did what I did. And when people would ask me, oh, what do you do for your skin? I would tell them, and they're like, that's it. I'm like, yeah, that's it. So I realized that actually people are doing a lot more than they really need to, and you really don't have to. So we all have busy lives. We all have a lot going on. So don't make skincare this elaborate, complex thing in your life.
So I am excited to talk more about this. Yes, because I think it's so easy to go any right into any store, whether it's a drugstore or something specialized, even your dermatologist's office, and there are so many options. What do we really need? Like, what are the basics? Break it down for us, please.
Yeah, absolutely. I am. I actually just before this podcast recording, I needed to go get my hairbrush broke, and I needed to get a new vitamin C serum. I had run out of mine, so I went to Walgreens, which I get most of my products from drugstores, and I kind of could experience what a normal person feels like in the drugstore, where you're like, oh my gosh, like so many choices. What do I choose? What do I do? So yes, I can empathize. But yeah, your skincare can be really simple, and it should be simple. I think for the best results, okay, I think you get the best results when you keep it simple. So for me, my skincare routine, I'll just say what I do, or let's just start with the basics rather. Your morning routine can be really simple. If you have dry skin, you don't even need to wash your face. I am not one of those people that says you have to wash your face twice a day. For people with oilier skin, you may want to, but in the morning, you can splash your face with water, or you can use a gentle cleanser. And then you've got to put on sunscreen. Those are kind of like the bare minimum basics. Now, for people with oilier skin, you may not need an additional moisturizer because your sunscreen can oftentimes act like that. But for a lot of people who tend to have drier skin or sensitive skin or even normal skin, and also depending on the climate, you may want to put on a moisturizer. Cleanse your face. That could just be water, maybe a moisturizer, and then of course sunscreen. So that's kind of like the bare bones minimal routine in the morning. And then in the evening, it's non-negotiable for me. You have to wash your face. So whether you wear makeup or not, you've got to wash your face. You've got to wash the oil, the dirt, the debris, everything from the day does need to be washed off. Again, a gentle cleanser. And typically, most people do well with a moisturizer so that their skin does not get dry. And that really can be it. That can be the basic if you really want to truly be a minimalist. Now, I do jazz it up a little bit with a few actives, and I think a lot of women do want to do a little bit more than just that, but you don't have to do a ton more. So, in the morning, again, wash your face or splash with water. Then, if you want, you can use a vitamin C serum. And I find that this is a great option for people who are uh, in their maybe mid to late 30s and older, who maybe are seeing some signs of what we call hyperpigmentation. Maybe there's some discoloration in their skin. They might have some darker areas than their regular skin. They might have some sunspots. Getting some early wrinkling. So I find that the vitamin C is a great product for brightening the skin and making it look refreshed, and also removing some of that early sun damage. And so you would do your serum, and then again, your moisturizer, sunscreen. And then in the evenings, I'm a big fan of a vitamin A cream, which people probably know as a retinol or a retinoid. And you can get over the counter retinols, and then a prescription is a retinoid. And that's a great option. I feel like this is like the holy grail for anti aging, pro aging, whatever you want to call it. You just put a little dot on your finger, you put that on your face, neck as well. And that can really help boost your collagen and keep your skin looking amazing for decades. I really credit that and sunscreen to why my skin looks the way it does now, because I've consistently been using that for, gosh, probably about 20 years now.
So we have just the basics there.
Yeah.
Fantastic. As you've mentioned, sunscreen, is it sufficient to have one that is, like you said, in your moisturizer, or there are some foundations that have an SPF included in them? Is that sufficient, or do you need a separate additional sunscreen if you're out in the sun during the day?
Well, so kind of both, right? So a sunscreen with a moisturizer is totally fine as long as it is at least SPF 30 or higher. And that's totally fine, especially if you're just going to the office, you're running errands. That's sufficient for sure. It is makeup, like sunscreen and makeup is not sufficient. I don't know many people who cake on their makeup so thickly and so opaque. That is not going to be enough. If there's sunscreen in your makeup, I don't really even like count that. So make sure you are still first putting your sunscreen with or without a moisturizer on first. And then throughout the day, if you are outside, if you work outside, if you're sweating, then you need to reapply every 2 hours. And this is really hard to do. And even I screw up on this a lot of times. So if you're at the beach, if you're swimming, if you're running, if you're sweating, you have to reapply that sunscreen. Like my sunscreen right now that I put on in the morning is no good. So if I were gonna, now we're hours later, if I was gonna go for a walk or spend time outside when I get home, I'm gonna reapply sunscreen on the exposed parts of my body, and I'm gonna also put a hat on. So that we talk about sun protection and we tend to just talk about sunscreen, but it's so important to do other things as well, like a hat, sunscreen. I try to wear like sun protective, like shawl or shirt if I know I'm going to be in the direct sunlight, or seek shade. So those are also important things to do as well.
You had mentioned vitamin C for, perhaps that sun damage, right? That happened before we were in our sunscreen protocol, perhaps, or for hyperpigmentation, which I've had as a result of pregnancies and different
Yeah.
hormonal changes and things too. So, with vitamin C, are there certain concentrations or things to look for, or ingredients to avoid, things like that?
Yeah, so the most common vitamin C is L-ascorbic acid, and that people may have heard like it is really finicky and sensitive to light, and so you want to get it in a jar that's dark, ideally not a dropper formula, because every time you open it and close it, you're allowing air to come in. So pumps are nice. Aim for about 10 to 15% concentration. If you go much higher than that, frequently, I think you get more irritation than actually any benefit. And so that's certainly the most common. The serum comes, it's real light. A lot of times it's more like watery. And so you're going to want to put that on first with your skincare. People a lot of times ask me, what's the order? So you want to go from thinnest to thickest. So that would go on first. Just a couple drops, rub it on. I also like to tell people, include your neck with your skincare routine. A lot of times we just stop at our chin, for like, look at what we're wearing today, right? Like our neck's exposed. So go ahead and extend it down onto your neck as well. And studies have shown that it actually can stay within our skin cells for a couple of days. So it's not necessarily something you have to redo every single day. These products can get pricey. So you don't need to spend a ton of money on it, as long as you are just getting that active ingredient, the 10 to about 15 or 20% L-ascorbic acid is what you want to be looking for.
Thank you. That's good to know. And for the the retin-A or the retinoids, like you had mentioned then as well, I know those come in different percentages. And where should somebody start?
Well, so a lot of people do not stick with vitamin A because it can cause irritation, or I should say it does cause irritation. And I sort of joke that I titrate up to just a little bit of peeling because then I know it's working. So just be prepared for that. You are going to experience some dryness, some peeling in the beginning. And so it's important to start low and slow, or you're never going to stick with it. So if you tend to have oily skin, you probably can tolerate a prescription strength. Go ahead and get the lowest possible. And again, just use a tiny pea size amount. You don't need a lot. And I don't recommend using it every night. Use it a couple nights a week until you build up tolerance to it. And I find if you're doing it in the summer, that happens a little bit faster, versus if you're doing it in the wintertime, you may never get above using it 2 or 3 times a week, which is totally fine. Now, if you are someone who's maybe mid 40s, perimenopausal, or menopausal, it may be too much to go straight to a prescription strength. And so you could certainly try over the counter products. They're not as strong. You could also try adapalene, which is sort of in the middle. But I would still tell you to start low, start slow. Don't use a lot of it. Don't use it every night. I say it's playing the long game. You have to just be patient. It's not an overnight success. It really takes a good 6 months of consistent use to see the results. But if you stick with it, you hang in, you will love it. Your face will glow. It really is amazing. Yes, start low, start slow. What I do now that my skin is getting drier is I actually put a moisturizer on my skin first. So right after I shower, I put on a moisturizer, and then I don't put my retinoid on until right before I go to bed. So my skin has had time to develop some oils and to get a little more hydrated. I find that if you put it on right when your skin is wet, you get more absorption than you want and you get more irritation. So as I've gotten older, that's a little hack that I do is I put my moisturizer on first and then I do my retinoid. And some people even will follow that with another layer of moisturizer. It just depends on how dry your skin is.
And is there a certain amount of time in terms of layering the products? How much time does it need to absorb, or does it depend on, brands or products?
Yeah, so it does just depend a little bit on what you're putting on. So if you do a vitamin C serum or any sort of serum, that's going to absorb really, really quickly. You should still give it about 30 seconds to a minute to absorb into your skin, and then do your next step, which is your moisturizer, and give it about 30 seconds to a minute, and then do your sunscreen. And that's another reason why you don't want to you have too many products, right? Because then you're just like, is it really getting absorbed if you're rushing to the next layer and rubbing it around? Is it actually penetrating into your skin or not? So yeah, less is more for a lot of reasons, but give it, if you are layering more than two things, give it a few seconds to actually absorb into your skin. But you'll find like thick products like Aquaphor, Vaseline, Petrolatum, those kind of products, you're not going to want to put something on top of that. That's pretty
Right.
pretty thick, and so that really should be the last step in your routine if you're going to do something thick like that.
Again, some great tips. Let's talk about some of the really common issues that women of all ages can deal with, and what suggestions and strategies do you have to combat the dreaded eye circles and
Yeah,
so forth?
gosh, I wish there was like one quick fix because this is something that affects so many people, men and women. It's really, I get this question all the time. And unfortunately, there's not just like one answer that I can give you because it really depends on why you're getting the dark circles. So, for some people, it's really just genetics. Certain backgrounds, ethnicities tend to have more darkening under the eyes, and you can see this even in children. So, this is more hyperpigmentation under that delicate eyelid skin. Other people will have more blood. Let me say it. Other people have increased vascularity under the eyes. So they will get either little blood vessels, either the blue green ones, or just some redness from more blood vessels under there. You're going to treat that differently. And then, sort of lastly, is just age related changes. So, a lot of time, well, not a lot of times, as we age, right? The fat pads under our eyes start to pooch outward. We have bone resorption in our central face and we lose volume there. And so you can get this sort of prolapse of the fat under our eyes. And then you get this like mound, which then results in a shadow under it, which people will say, oh, this is why I have dark circles under my eyes because of that shadow. So it really depends on why you have the dark circles. But one of my favorite, of course, sunscreen for all of this, right? But for the pigmentation, there are a lot of great lightening creams out there. And I find the best lightening cream is often a mix of a lot of different ingredients from things like kojic acid to niacinamide, sometimes light acids, alpha hydroxy acids or beta hydroxy acids. Those are all things that can help remove that pigmentation in the skin under the eyes. So That's a great option if you have more of the pigmentation. If you have more of the increased vascularity, lasers can zap that out. And then for more of the age-related changes, you may need to have what's called a lower blepharoplasty, where we remove some of the fat that's pooching out. And a lot of times, putting a little extra volume into the cheek with filler can be helpful as well to make the transition smoother. And then, of course, the other thing is just what are you eating? How much water are you drinking? How much sleep are you getting? Because we all know that that exacerbates the darkness under our eyes as well. So making sure you're getting a good amount of sleep, you're not drinking alcohol excessively and getting dehydrated and not drinking water. So things
Okay.
like that are important too.
Thank you. So, what about some of the skincare truths versus hype, right? You go onto social media these days and there's all sorts of things out there. Is there anything on your radar right now that is getting a lot of buzz and you're like, ugh, that's just not worth the hype?
Oh gosh, I mean, I don't even know where. It's always something new and it spins so fast. My just overall advice would be social media is wonderful in so many ways. It connects people. It's a way to share information that you may not have heard of, but it's also a way for people who really are not experts and really don't know what they're talking about to with a megaphone, send out their message, and it may not be the right message. So I would just caution, if it sounds too good to be true, it probably is. With a lot of skincare stuff, there really is no one quick fix. So anytime someone is promising to remove all your under eye circles and bags with one little cream that you use, I would be a little bit cautious about that. And like, look at the source too. I mean, are they selling you a product, or are they truly just giving you information? But one of the big things I'm seeing is a lot of like DIY skincare, where
Mhm.
doing flaxseed mask at home as a substitute for Botox, or apple vinegar soaks for acne, and things like that. I would just caution using some of these at home remedies. At worst, I guess, is just a waste of your time and a waste of ingredients, but you can actually have side effects from this. I had a friend whose daughter soaked some cotton balls in apple cider vinegar, taped it on her forehead for her
Ooh.
acne, and when she woke up in the morning, she had these white circles on her skin because she had more olive skin. And that required a lot of expensive laser treatments to help her repigment. So these, even something natural, can have consequences. And so in general, I say stick to eating your food and see a dermatologist for like real legitimate skincare guidance.
Mhm. Yes. Let's talk about treatments because we are hearing so much more about laser treatments. Certainly, there's the at home, but I'm talking more in office or med spa types of treatments. What is worth what's worth it in terms of um, like where somebody starts because there are so many options.
Yeah, it can get so overwhelming for sure, and it can get expensive, and for most people, it's just not realistic to think you can do anything and everything out there. So, my first recommendation would be see a dermatologist. This is someone who has trained in the skin, on skin diseases, normal skin, as well as extensive training with cosmetic procedures. And I find, see a dermatologist and really try to develop a relationship with someone you trust, where their sort of aesthetic look matches what you're going for. Because if you're seeing someone who is all filled up with filler and sort of a more exaggerated look, and that's not your look, it's not gonna, that's not gonna necessarily be a good match. So find someone who has sort of understands your aesthetic goals. And again, like I said earlier, there's really no quick fix with skin. And so it requires a relationship. And a lot of times someone comes to see me for the first time. My first thing is, well, what bothers you? Because I want to know what bothers them. Sometimes they'll say, well, you tell me, but really I want to hear when they look in the mirror, is it the dark circles? Is it maybe the wrinkles, or that their skin texture is uneven? I want to hear in their words what frustrates them when they look in the mirror. And if they've never done stuff before, I never like to start out, going with the most extreme option. I always like to start small, start with little things, start with things that are potentially reversible or not permanent, just to kind of dip your toe in and make sure you really are comfortable doing this. I also like to make sure that they have a good skincare routine at home, that they're wearing sunscreen. Because if we're going to do a $1,000+ resurfacing, chemical peel, it's not going to do you any good to then go out and sunbathe. You're just wasting your time and money. So I think having that relationship with a dermatologist, letting them know what bothers you, and then hearing what they recommend. I usually try to give a bunch of different options, depending on where someone is. But you don't have to do a ton of stuff. I think that's what people think. Oh my gosh, like I'm going to be spending tens of thousands of dollars. I need to go in every couple of months. You don't have to do that. In fact, up until a month ago, I had never had a laser or device on my face. And it's not because I'm not around it or I couldn't have it. I just didn't feel like I needed it. And so if you don't need it, just because your friend got it or some celebrity's promoting it, it doesn't mean you have to get it. So just get treatments based on what you need, what you're trying to correct or fix. And that's where I think the advice of a dermatologist who can really give you sort of the big overall, like, okay, here are our options, and isn't just trying to sell you one procedure because that's the device they have. So yeah, I mean, there's just so much. It really just depends on what bothers you and sort of your comfort level. And again, start small. You can always build up and do more.
And I like how you said with your comfort level too, right? Because some of those are quick with essentially no downtime, and others are red skin. You're going to have the flaking for days or weeks types of things. So
Yeah.
certainly be aware of what it is that you are going for. And I know I've been working, I had a very distinct melasma mask when I was pregnant 17 years ago with my son. And it was years of treatment. One, because I grew up with a pool as well and still had one. And so for me to be able to stay out of the sun and stop it from reoccurring was my own issue. But finding I could afford it, because of course it's not covered by insurance, and then yeah, maintaining my own skincare routine and the treatments to get to the point where it doesn't look like I have a suntan with sunglasses on my face for
Yeah.
the rest of my life. But
Melasma is definitely one of those tricky ones
mhm.
where it's almost like the harder you treat it at first, the worse it gets. So you really have to go slow. But you bring up a great point that sun protection with melasma is so key, and it can be really difficult.
And like I said, I was shooting myself in the foot because it's like, but I love being in the sun and it feels so good. And how do I do that? And then I had a pool in the backyard. So yes, hats, sunscreen, all the layers. And instead of flushing money down the toilet, Kristen, let's be a little bit smarter about this. And of course, just taking care of my skin. So some of us are slower learners than
I
others.
know.
We'll say that.
We all have our challenges.
Yeah. We touched on it at the beginning, just kind of those skincare changes. And I'm in my mid 40s. And so going into the perimenopause and menopause and just anti aging changes, what are some of the, um, well, we want to talk about preventive measures, but what is happening to our skin, like through that menopause period and as we're aging?
So that's I'm so glad people are finally talking about this too, right? So menopause is when women are no longer having their period, and estrogen, basically we are not producing estrogen from our ovaries, and estrogen we're now realizing is so critical to so many parts of our bodies, not just our bones, but our skin, our brain, our gut, everything it can really affect. And so women can start to notice these changes even in their late 30s and into their 40s, because the average age is 51. So there'll be some women who develop it earlier, and then some who develop it later. But one of the most common things people will start to notice is that their skin becomes drier. It's harder for our skin barrier to hold on to moisture as our estrogen levels are dropping, and so your skin will get drier, flakier. You may get be more prone to rashes. And then the other thing that a lot of people notice is they will feel like their face is falling or melting. They will start to get more lines around the eyes. They may get some more jowling around their jawline. They may notice their skin is a little more wrinkly and doesn't quite bounce back. And that's because we're losing collagen and we're losing elastin in our skin, which estrogen, the decrease in estrogen is responsible for that. We're also getting bone resorption. So our bones actually change. So our jawbone starts to recede. You may notice you have gum issues and issues with your teeth because of that. We start to have flattening of our central face as well. So a lot of changes are happening. You may notice some weight gain, especially around the abdomen, right?
Mhm.
So a lot is going on with our bodies, and it's predominantly due to the drop, the plummeting of estrogen that we have been relying on for all these years beforehand. So that's kind of what's going on now. This is a natural thing that happens, right?
Mhm.
But it doesn't mean there aren't things we can do to improve upon it and to stay as healthy as we can.
Yeah. And that's fascinating. I didn't realize the jawbone was actually receding and changing. That certainly makes sense, um, as notice that people age, or you look at somebody who is older.
Yeah.
I didn't realize that actually happened though. So all these things I learned on the podcast. It's fascinating. Let's touch on one more topic here. At home devices. So we're seeing more and more. We talked about in office treatments, but we're seeing more and more also with like the light therapy for acne or for anti aging. Let's just start with that one. Do they work? Is it worth it?
So I do find there's this big push for these at-home devices, the exercise, the lymphatic drainage, all this stuff. People want to feel, I think, like as proactive as possible. And we do know that LED lights can be very therapeutic. They can help decrease inflammation, and we know like the in-office ones, they have a lot of positive benefits, enhance collagen. The question, though, is do the at home devices adequately mimic that? Are the bulbs strong enough? Is the energy high enough? And then what's the correct dosage? How long do you need to wear them? So there are a lot of things we don't fully know. And unlike the devices that are in like your doctor's office, the at home devices are not really regulated the same way. And so you don't always know what you're getting, and these devices are really, really expensive. So I don't think there's necessarily anything wrong if you want to get an LED mask. I certainly know people who do it and they love it. You have to do it every day consistently for like 10, 15 minutes. So if that's your routine, you want to put it on and journal or meditate. I don't have a problem with that. I personally, it's not for me. I don't want to do that. I have a hard enough time remembering to floss for 30 seconds, let alone put something like that on. I just think we need more data. If I'm going to spend $1,000 or however these masks are, I'm gonna do something else. I'm gonna put that money towards something that I don't have to do all the time. Again, I really like to keep it simple. I want like the biggest return for the least amount of effort and work.
Yes.
So I don't necessarily have a problem with it, but am I going out telling people to buy them? No, because I think there's just too many variables on what the right strength is in the dosing usage. So but people are trying, I think there's a thing called new face that stimulates your muscles. And again, it might work, maybe, but you got to use it all the time. You got to be consistent. So again, to me, that's just like one more like chore I got to do at home. So
Mhm.
I'm not a big fan of these at home devices. I think you can get a bigger return on your investment by actually just going in and having an in office procedure personally.
Sure. And like you said, there are so many. And my daughter had brought one face mask up. She's a teenager, and it's like, well, Okay, so we have the $69 version, we have the $300 version, and the $1,000 version. So
Yeah.
clearly more expensive you would think would be better.
Yeah,
But at the
but
same
not
time,
necessarily.
right, for my 13-and-a-half-year-old, I'm certainly not going to be making that investment for this whim of hers at this point in time. And but it is a hype sort of product, and at least for her right now.
Yeah,
So
and I'll just say another thing about expense, right? Like don't always equate more expensive with better. Like I said earlier, I do get most of my products from the drugstore. Um, with the exception of maybe like I do like Elta MD sunscreen because I think it's a good mid-level price range. But I use Dove cleansing bar from the grocery store that's like $2. And, people give me stuff all the time to try. And they're nice and all, but it's like I just keep going back to my tried and true. It's affordable, it works. So don't think you've got to be spending $50 on your cleanser for it to be effective. It's not true.
yes, and thank you for that. And listeners, you can't see Dr. Mina, but her skin is fabulous. So um,
I'm
that
sitting right next to a very bright window, so I think that helps.
well, yes, it helps with that glow. But even before when we talked, of course, you have fabulous skin and are doing a great job taking care of it. Let's just close with skin cancer and prevention. We know that sunscreen is fantastic for that. Is there anything else that should be on our radar just with the in increase in skin cancers?
Yeah, so I'm so glad we talked about this because I think all too often we talk about skincare and we're talking anti-aging and wrinkles and all that, but we're missing a really important component, and that's skin cancer. And skin cancers are on the rise. And skin cancer is not just melanoma. So melanoma is a deadly form of skin cancer. That is also on the rise, but we're seeing more basal cell carcinomas and squamous cell carcinomas and even Merkel cell carcinomas, which is what Jimmy Buffett died of, which kind of opened people's eyes to that. So treating skin cancers is a big part of what I do, and I'm seeing patients younger and younger every day. It's really alarming. The most important thing I would say is, well, however old you are, it's not too late. Of course, the sooner the better. Prevention is key because with skin cancer, for most of these, I will say at least squamous cell and basal cells typically, it's due to cumulative sun damage that builds up over your lifetime. And so if you are getting your first skin cancer in your 20s or 30s, you've already had considerable sun damage. And so however old you are now, start now. It's like planting a tree. The best time to start was 20 years ago, but the second best time is now. So prevention is key. And that's where wearing sunscreen every day is super important. If you put it on in the morning and then you go golf 6 hours later, you got to reapply, or you play tennis, you got to reapply. Um, I love sun protective clothing, so hats. I'm a big fan of sunglasses, and then I wear rash guards at the beach. I mean, I'm not afraid to go outside. I love being outdoors. I have children. We go to the beach, we go to the pool, but I wear, if I'm out in the sun or I'm swimming, I wear a rash guard, or I have like a UPF like shawl thing I throw over. But the clothing nowadays, it can be really cute. It wicks away the sweat, so it's actually very breathable to do activities in. So just try to minimize the time that you feel the sun just beating down on you directly, because that's causing damage to the DNA in your cells. And it's prevention is key. And I hear this all the time in my patients. A lot of my patients are older and they will tell me, I wish I knew about this when I was your age or when I was in my 20s or 30s. And they feel like remorse that they didn't know and they couldn't try to prevent it. And I think sometimes people think, oh, skin cancer, it's not a big deal, but skin cancers can kill people. We're actually seeing an increase in deaths from skin cancers, not just melanomas, but squamous cells. And the best way is to prevent them or to treat them when they're really early before they've had a chance to spread or become really aggressive. So if you apply it correctly, they should be equally effective. But here's the problem I see with the sprays at the pool and at the beach is people spray it and you see this big plume of the aerosolized product, not even reaching the person's body. So the trick with the spray is you spray your arm or you spray your legs, you have to rub it in as well. So make sure you're not just spraying and running. But I like sprays. I mean, they're great for children, but you've got to rub it in. You don't want to spray directly on your face. So instead, spray on your hand, then you can rub it on your face. But you have to rub it in. And again, where people will tell me, oh, I wore sunscreen to the beach, but I still got sunburned. The problem is people are forgetting to reapply. And so I don't love putting tons of stuff on my skin. And so that's where I love the sun protective clothing, because I don't have to worry, oh my gosh, should I really rub it in under my strap here, or do I have to check? So I just put on that rash guard and I don't have to worry.
Residue from the lotion, especially if you get into some of the waterproof, the sweatproof types of lotions that I put it on and then I just feel
Yeah.
sticky afterwards. And so using the clothing is certainly another alternative. And I know my hairstylist tells me as well how much better it is for my hair when I'm wearing a hat and having that covered.
Oh,
So
yes. Yeah.
you get,
It
that bonus, especially if it's, colored hair. So,
Yeah, and speaking of like what procedures get in skincare and all that, I mean, really like prevention from sun damage is the best thing you can do for your skin. If you are someone who's like, I don't want to do a lot of cosmetic procedures, I don't want to have to be spending all this money on devices and all that, then the best thing you can do is be vigilant in your sun protection. I see this all the time in my older patients. I'll see their stomach versus their arms and their legs, and it's just stark difference. The part that's been sun protected looks amazing versus the parts that's just been out exposed in the sun.
well, thank you so much for this conversation. There has been so much insight and really peeling back the layers of the basics that we need for skincare. And so we know that that could be as simple as washing your face in the evening with Dove soap
Yeah.
and some moisturizer. So as well as debunking some of the other myths and things that we have seen. So any
Yeah, well, so I do know, of course, it can be overwhelming. So I would just tell people to try to stick to the basics, try to make sure you're getting your skincare guidance from true experts. I do have a free PDF if people want to learn how to create healthy skin habits for themselves. It's just theskinreel.com/habits. And people can follow me on Instagram, YouTube, and my podcast as well, The Skin Reel. And I'm at Dr. Mina Skin for people who just kind of want unhyped, real skin education.
perfect. And I will link that in the show notes as well. Please go check those out. Thank you again, Dr. Mary Alice Mina. And to all of my listeners, I will talk to you next week. Thank you for listening to the Stop Overthinking podcast with Kristen Odegaard. If you enjoyed this episode, please share it with someone else who would benefit from the message. To learn more about working with me and links to social media and free resources, head over to my website, coachwithkristen.com. That's Kristen spelled Kristen. Be sure to subscribe to the podcast so you don't miss future episodes. Have a great week.